Okay, and here we go into the room.
Having a medical procedure done can be scary for children, but the more they know and understand in advance, the better they'll cope. Our goal is to make pain, anxiety, and comfort management a fundamental component of pediatric care. If we focus on the experience as well as the procedure, it's likely to be a much better outcome for everyone involved. Here are 4 vital steps to establishing comfort management when working with children. And we're talking about children of any age. Step 1. Ask.
Dad, has Jackson ever had an IV, or have you ever had an IV?
This is an important conversation for the nurse and child life specialist to have with the family.
Have you ever had an IV placed?
Ask the child and caregiver what they know and how much they understand about the upcoming procedure.
So you're going to be here for Dr. DeSenders to put your ear tubes in later? Yeah? Do you have any questions about any of that?
Use this time to dispel any misconceptions and answer any additional questions. Step 2. Share.
I'm going to put a little straw into your hand here, okay? And we're going to be able to give you some medicine through that to make you sleepy. I'm going to have my friend Emily over here. She's going to talk to you a little bit more about it.
Describe the procedure in simple terms using honest, age-appropriate language.
Where do you see spots, Ivy?
Acknowledge the patient's fears and concerns.
How are you feeling?
A little nervous.
A little nervous? Well, thank you for being honest with me. I appreciate it.
And it's going to kind of just give your arm a little tight squeeze.
Include sensory experiences, like how the procedure might feel, smell, or look like to the patient.
So she is going to have alcohol wipes, and that helps clean your skin really, really well. Okay, it doesn't exactly smell like roses.
Families may be offered a comfort card. Make sure it's updated in their chart and used accordingly. Step 3. Plan. Now this is the most detailed of the steps and includes 4 components to help the child, caregiver, and medical staff develop an individualized plan for coping during the procedure.
And you'll have to let me know if this is a good idea for you.
Include their thoughts and ideas to establish a mutually agreed upon comfort goal.
So you can squeeze your stress ball and think about camping. Okay, and then some other questions I have for you. Would you like to watch Carter while he's placing the IV?
I prefer looking away.
The 4 components include medicine and numbing. Remember the use of oral sucrose for children up to the age of 1 year. Discuss pharmacologic and non-pharmacologic interventions, like the use of numbing cream, numbing poke, pain ease, or Buzzy.
Oh, I can feel him too.
Refocusing. Talk about what strategies could be used to refocus and reduce anxiety. Toys, electronics, books, music, and bubbles can all be positive distractions.
Taking nice deep breaths really helps relax the body. So can we practice a few?
Practice breathing and relaxation techniques. Identify who will lead the refocusing techniques and whether additional staff are needed. Positioning. Sitting up is preferable unless the child chooses to lie flat or the procedure requires it. This helps the child feel more in control. There are additional positioning strategies for babies and toddlers that may provide comfort. If family members will be in the room, let them know how they can help.
Let me give you a kiss.
Environment. This includes lights, noise, and especially talking. Work to decrease the commotion in the room to calm the child. The treatment room, or an area that's away from where the child sleeps, are best to use when possible. Use one voice throughout the procedure so the patient isn't overwhelmed by multiple voices. Consider word choice carefully and make sure it's age appropriate.
And thank you for holding still. You're doing a really good job, okay?
Step 4. Do.
I'm going to do some work over here.
Continue to assess pain, anxiety, and patient response using agreed-upon coping techniques when necessary.
Little pressure. Good job. Well done.
Provide verbal coaching in a calm, reassuring manner.
Did we all do a good job? I think you did the best job.
Monitor family member and staff behavior and provide feedback to ensure the environment remains safe and relaxed for the patient.
All done.
When everything is done, validate the patient's efforts. Ask how the coping techniques worked for them. Don't forget to update the snapshot and comfort card. Make sure when documenting the procedure that you include an evaluation from the patient, family, and provider perspectives. And remember, coping can look different for each child. For more information on these 4 comfort management practices, as well as additional details you might find helpful, visit us online.